My name is Peter Fry and I'm the Travel Manager for International Care Ministries. Over the last 12 months, ICM has brought 43 different vision trips into the Philippines. Here in Hong Kong is where we arrange these trips, putting together the schedule with the flights and the hotels. But how about I bring you down to the Philippines and tell you a little bit about the work we're doing. ICM is working only with the ultra-poor people of the Philippines. Ultra-poor referring to people living below the subsistence level and on less than 50 US cents per day. These people are living in desperate situations. The homes that they live in are in terrible condition, clean water is rare, food for their family is scarce, and the mortality rate is extremely high. Understandably, these people have little hope for the future, and their children are bearing the cost for this. But what if? What if we were able to give them the education, the training, and the time that they needed to build a future for their families? So how do we equip these people? Well, ICM will partner with the local community leader to identify 25 of the poorest families in each community. Then we will get these family members and bring them to a training session in their own community where we will teach them about values, health, and livelihood. Now, our trainings are designed for a semi-literate audience who are best taught orally, and our training materials are written, but they contain a lot of pictures to make sure that the participants know exactly what is being taught. Our values training builds the foundations of hope, because unless the poor can feel optimistic about the future, how are they expected to implement the rest of the lessons we're trying to teach them? One way in which we do this is we will visit the homes of each participant weekly to answer their questions and show that we care for them individually. ICM's health training is based on a UN curricula, and it teaches the basics of disease prevention, nutrition, hygiene, and other health information that is essential to the daily lives of the poor. ICM's health training is cutting the incidences of chronic illnesses in half. Our livelihood training focuses on low capital projects such as organic vegetables and worm farming. Last year, we distributed nearly 15 million seeds to the participants in our programs, and we now have over 1 million worms producing organic soil. ICM's training programs are increasing the income of our participants by about 30%, and I know we'd all like a return like that in 4 months. ICM has a pretty big footprint in the Philippines, with 300 full-time staff working with leaders in around 2,000 different communities. In fact, last year alone, we ran our VHL program in around 500 different communities, training nearly 100,000 family members in our VHL program. We are changing the face of poverty in large sections of the Philippines, bringing hope to one parent and one child at a time.